When you think of a huge medical breakthrough, what comes to mind? Probably a high-tech scanner or some complex genetic test, right? Well, what if I told you that one of the most powerful tools we have is just a simple story? Today, we're diving into the case report, how one patient's experience can sometimes change the world of medicine. Let's get into it.
I mean, really think about it for a second. There are millions of people taking thousands of different medications. So how on earth do we spot that very first sign of a rare, maybe even dangerous side effect? How do we catch that one tiny clue that something totally unexpected is happening? Well, believe it or not, the answer isn't in some supercomputer. It's found in a story.
All right, so here's what we've got on tap. First, we're going to break down what these unexpected stories actually are. Then, we'll see how they act as our first warning signal. After that, we'll get into some absolutely mind-blowing stories that literally changed medicine. We'll also talk about the flip side, the limitations, because that's super important. And finally, we'll wrap it all up by looking at the incredible power of just one single person. Okay, let's jump right in. What is this powerful tool we're talking about? You know, it's not some billion-dollar clinical trial. It's not a fancy algorithm. Nope. It's something way more fundamental, way more human. It's an unexpected story. So what we're talking about here is called a case report. And really, it's just a detailed story. That's it. It's when a doctor sees something unusual in a single patient and writes it down. There's no big experiment, no control group. It's just a careful, focused observation of one person's experience. You know, maybe they had a really surprising reaction to a medication. And this, right here, is what's so wild. We are talking about one of the simplest, most basic forms of research you can even imagine. And yet, its impact can be absolutely massive. It just goes to show you, sometimes the tiniest little observation can be the spark that ignites a huge discovery. Okay, so how does this all work in the real world? Well, I want you to think of a case report like a smoke detector for medicine. It's not the firefighter who puts out the blaze, right? But it's that critical first alarm, that little beep that says, hey, pay attention over here. It's what turns a simple observation into a serious scientific question.
Now, this is a really important point, so listen up. A single case report can't prove that a drug caused something. It can't. I mean, it's just one person. It could totally be a coincidence. But what it does do, and this is its superpower, is it generates a hypothesis, an educated guess. It's that first little breadcrumb that tells scientists, hey, you might want to look into this. And when other doctors start reporting the same thing and a pattern starts to form, that's when the real alarm bells go off.
So let's walk through the domino effect here. It always starts small. A doctor sees something unexpected in their patient. They write it up and publish it as a case report. Then another doctor somewhere else reads it and goes, whoa, wait a minute, I saw that same thing in my patient. Pretty soon, more and more reports trickle in. That's when you get a pattern, or what scientists call a signal. And that signal is the trigger. That's what tells regulators and researchers, okay, it's time to launch a full-blown investigation. Okay, I know this might all sound a little theoretical, so let's get to the really good stuff. Let's talk about some incredible, true stories where a single case report didn't just ask a question. It completely changed the course of medicine. For real. Our first example is, it's a tragic story for sure, but what we learn from it, its impact on keeping patients safe, you just can't overstate it. This is the story of a drug called thalidomide and the one doctor who dared to raise the alarm. So back in the early 1960s, thalidomide was a super popular drug. But then, on December 16, 1961, this doctor in Australia, Dr. William McBride, he published what was essentially just a letter to the editor, a case report. And in it, he suggested a link between this drug and the absolutely heartbreaking birth defects he was seeing in newborns. That one single letter was the moment everything changed. It wasn't just that the drug got pulled off the market. No way. It actually gave birth to an entire new field of science called teratology, the study of birth defects, all designed to make sure something that terrible could never, ever happen again. But it's not all doom and gloom. Case reports don't just warn us about dangers. Sometimes they point us toward incredible, unexpected discoveries. Let's talk about a much happier accident, the story of Minoxidil. So get this, Minoxidil was first developed as a pill for high blood pressure, totally unrelated to hair. But then, doctors started noticing this kind of weird side effect in their patients, hypertrichosis, which is just a fancy way of saying they were growing more hair. So a case report gets published about this strange side effect, and you can just imagine the light bulb that went off in someone's head. That one little observation about a supposedly unwanted side effect, it led directly to the creation of one of the most famous hair growth treatments on the planet. Just wild. Okay, so we've seen how powerful these stories can be, right? But it's really important to look at the whole picture here. We have to be honest about what a case report is and what it isn't. It's a clue, it's a starting pistol, but it is never the finish line.
On the one hand, the strengths are pretty clear, right? They're an amazing early warning system, and they're perfect for spotting super rare reactions that would never show up in a normal study. But, and this is a big but, you have to remember the weaknesses. A case report cannot prove cause and effect. That thing that happened could be a complete and total coincidence. And you definitely can't take one person's experience and apply it to everybody. In the hierarchy of scientific evidence, yeah, it's at the very bottom. But you know what? That's okay, because its job isn't to give us the final answer. Its job is to help us start asking the right questions.
So where does that leave us? We've looked at the good, we've looked at the not so conclusive. What's the big takeaway here? Well, for me, it comes down to something really simple. The incredible, undeniable power of one. All right, let's wrap this all up. We started with this idea of a simple story, the case report. We saw how it's not about proof, but about being that critical early warning system, providing those first vital clues. And man, did we see how powerful those clues can be, from the tragedy of thalidomide to the happy accident of minoxidil. They can save lives, they can create whole new treatments. It's always, always that crucial first step on the long journey of discovery. When you boil it all down, it really just comes back to this one number. One. One doctor who's paying attention. One patient and their unique story. And that one story, when it's shared, has the power to create ripples that can change absolutely everything.
And I want to leave you with this final thought. Right now, as we speak, there is a doctor somewhere in the world noticing something a little different in one of their patients. And it just makes you wonder, doesn't it? What's the next big discovery? What life-saving warning or unbelievable breakthrough is just sitting there waiting inside that one person's story? Pretty amazing to think about. Thanks for watching.